The WeRPN Workplace Violence Prevention Toolkit, Module 3, Responding to Harassment, Bullying, and Workplace Violence. This module includes individual responses to harassment or bullying and the effects of bullying on the individual, including typical symptoms and the nurse's response. How you experience bullying and harassment is unique to you as an individual and not necessarily the result of what was intended. It is up to you to decide if you're being bullied or harassed because you find the behavior unacceptable. Individuals who are being bullied display a range of symptoms. It is important to recognize and determine if you are experiencing any of the following symptoms: sleeplessness, loss of appetite, loss of confidence, self-doubt, excessive double-checking actions, inability to relax, or inability to switch off work. Nurses respond to violence in many ways. Individual responses can vary depending on the nurse, personal values, physical environment, cultural and professional expectations, and personalities. Some nurses may respond in a non-visible way. Some may respond with denial. Some may respond in a passive-aggressive way. Some may respond in an accepting manner, thinking this is part of the job. While some may be very active, example being verbally confronting the perpetrator or even pressing charges against them. What is important is that colleagues and employers support the nurse who has been the victim of abuse. It's also important that RPNs must understand the perceptions of abuse and their response to abuse. Dealing with harassment and bullying. There are several approaches to dealing with harassment and bullying. The most appropriate approach for you depends on what you are most comfortable with and your specific circumstances. Before you make a decision, you need to think about the feelings you're experiencing. Some people may feel self-doubt, while others may feel a loss of confidence and/or self-esteem. Confusion about self-worth may make it difficult to recognize what is happening, feeling strong enough to take action, or knowing what action to take. Some examples could be confronting the person and having an important conversation about the situation. They may not even be aware of their actions and the impact of their actions. Reporting the event to your immediate supervisor and having them be aware of the situation may prompt further discussion of such events. The International Council of Nurses, 2007, has identified typical responses to violence in the workplace, stating that once violence occurs, treatment of injuries, if any, takes precedence. However, whether in need of treatment, nursing personnel tend to choose among the following responses. Avoidance. The victim avoids the problem or the perpetrator of violence. The response or outcome of avoidance is that it may lead to the interference of the performance of your duties, and no resolution to the problem is possible. Patient care and safety may be compromised, and the risk factors may become heightened. In denial, frequently traumatic events are suppressed. The outcome of denial may be that no resolution of the problem is possible, and maladaptive behaviors may appear. Now it's your turn to have a discussion. When seeking support, consider discussing the incident informally with team members, family, and friends. Reporting. It is estimated that only 1/5 of the cases are officially reported. There are many possible reasons for this, including fear that they will not be believed, that their cases will not be dealt with sensitively, that they will appear weak, that nothing will be achieved, that similar complaints have failed, or that the situation will only be made worse. Until you speak up and do something about it, it is unlikely that the bullying and harassment will stop. There are two possible actions. Counseling. The positive impact of counseling has been confirmed for both the victims of violence and for persons indirectly involved in the incident. The outcome of counseling could help to resolve the emotional impact on the individual who's been affected to help support their journey in healing. Prosecution. Nurses are not legally required to tolerate abusive behavior. Prosecuting offenders is rare, however, depending on the degree and severity of the situation. This option could be explored in greater lengths. This option involves legal proceedings through the courts that may result in a lengthy process. This ends Module 3. Next, we move on to Module 4.